I'm going to start by inviting Dr. T.R. Raju to give his presentation, his thoughts, share his ideas. In fact, I must declare that on an informal discussion a couple of weeks back between me, Manjunath, and Dr. Raju, the idea of the post-COVID management came up, and the American Academy of Yoga and Meditation immediately endorsed it. And we thought we should have a good discussion on this subject. And Dr. T.R. Raju, I will formally introduce. He's retired from NIMHANS and is currently serving as the A.S. Painter Distinguished Research Chair with the Indian Council of Medical Research. He's also former head of the department Neurophysiology at NIMHANS. And he's an expert advisor to government and non-government organizations and has a strong research interest, from what I know him, as a neuroscientist in ALS, amyotrophic lateral sclerosis. If you look him up, you will find a bunch of research papers in amyotrophic lateral sclerosis, how this disease progresses, a lot of experiments in high-ended journals. So I will, without much ado, request Dr. Raju to please come over and share your thoughts, and we'll have the discussion kicking thereafter. Welcome all. Welcome, Dr. Raju.
A very good morning to my American friends, and a very good evening to my Indian friends. Let me thank Dr. Akshay Anand for a generous introduction. Also, thanks a lot for inviting me to participate in this webinar. We have to admit the fact that a negative COVID test does not mean recovery. There are several long-lasting symptoms, or the virologists would like to call it sequelae, following discharge from the hospital. There is persistent cough, shortness of breath, headache, weakness, and severe fatigue for mental and physical activity. And this would not go away with rest. This is something, the kind of fatigue which they have never experienced before in their life. Truly sad indeed. COVID-19 affects cardiovascular system, pulmonary system, haemopoietic system, brain, lungs, kidney, endocrine, and immune systems. About cardiovascular system, I'm sure Professor Sushil Sharma, who is an expert in this area, will tell you more. But I would briefly say that there is an occurrence of myocarditis. The heart muscle breaks down. The sarcomere is affected. The cytoskeletal proteins is released. And also endocarditis, the lining of heart muscles, the lining of blood vessels of the heart, the lining of valves, it degenerates. So this would end up with sudden cardiac arrest and death. I heard an incident just a few days back. A relative of one of my friends who was discharged from the hospital, whose oxygen saturation was very good. But at home, after a day or so, he suddenly collapsed and could not be revived. When you talk about the respiratory system, the alveoli becomes narrowed. And also there is fibrosis of the lungs. The lungs lose the elastic property. So that is why vital capacity, the lung capacity, is reduced. And another dreadful thing which happens to these people is formation of microclots. These microclots can go and lodge in different organs, whether it's lungs, kidney, or recently I heard that the central artery of retina gets affected, and patient suddenly in the recovery phase becomes blind. And if you talk about brain, we do not know whether this virus directly affects the neurons. Probably we believe at this stage that the glial cells like microglia and astrocytes are affected, and it produces a very aggressive neuroinflammation resulting in seizure, stroke, and also other behavioral problems, loss of smell, loss of taste, delirium, and difficulty in sleep, anxiety, stress, PTSD, as told by Dr. Akshay. So all these things occur, and the quality of life gets completely compromised. So in a place called Bergamo in Italy, Lombardy region, this was the first place to be affected by COVID-19 in Italy in the month of March. 5,000 people died out of a total population of nearly 110,000. Then after 6 months, they wanted to check how the surviving people are doing. And 50% of them said, we have not recovered fully. Imagine the situation. So how yoga can help? Yoga can bring about beneficial effects on central nervous system, autonomic nervous system, cardiovascular system, respiratory system, endocrine, immune system, and the list goes on. So, when the autonomic nervous system acts in harmony, when there is an increase in parasympathetic activity following yoga practice and decrease in sympathetic activity, the heart gets protected. HRV, heart rate variability, increases. That also confers protection to the heart. And when you practice pranayama, the lung capacity increases. The vital capacity is more, so it helps in breathing. Then, if you look at the brain as such, there is a substantial reduction in the anxiety. There is a substantial reduction in the stress because HPA axis, yoga can act through HPA axis, and it is beneficial for hippocampus, prefrontal cortex. Your cognitive functions are protected. At the same time, it suppresses amygdala. So that reduces anxiety, that reduces fear. And another important thing is if you look at the immune system, practice of yoga enhances anti-inflammatory cytokines like IL-4, IL-10, decreases the expression of pro-inflammatory cytokines like IL-6 and TNF-alpha. So you get protection from the hyperimmune system or inflammation, hyperinflammation, which is taking place post-recovery too. So I strongly believe that yoga has a very useful role to play in the rehabilitation of post-COVID patients. Thank you. Namaskar.